If this is going to be one of these videos where I can't get my words out properly, I'm just going to stop filming and draw a line under today because it's clearly not working. Hello everybody, it's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today I am going to be doing a kind of request from a couple of subscribers, but not really. Basically, let me explain. So a few people have asked me to answer some radiography questions for them. If you've been watching my channel for a while, you will know that I suck at radiography. I don't get it, I can't do it, I'm just not very good at it. So obviously every single reply to those kind of questions are, I'm really sorry, I don't know. The reason I don't know is because I was in college like 5-6 years ago, so I don't remember what I learnt then because it was such a long time ago. I genuinely just can't remember. To kind of answer some questions, what I thought I would do today is go back through the questions and answers for Dental Nurse's book, but specifically the radiography category. Now I'm going to be doing 6 questions from this book and seeing if I know the answer. If I do, brilliant. I'm not very hopeful for this because I know I'm so bad at radiography. So I know that that doesn't really help that much, but I'm hoping that by answering these questions, and even if I get the answer wrong, I will be going through the correct answer and why that is the correct answer. So it might help just a little bit. Anyway, I think that's going to be it for this intro now. I'm sure you guys don't want to hear how bad I am anymore. If you would like to see me attempt to answer some of these radiography questions and maybe learn a little bit yourself, then just keep watching. Okay, so like I said, we're going to dive straight into this book. Let's just find the radiography section first of all. Maybe I should have checked this before I said I was going to do this video because I can't actually find a specific radiography chapter. Well, you can see how well planned these videos are, can't you? I know there's radiography questions in here. We need pages 65 to 76, which is assessment and diagnosis. So basically I've just got to find all of the questions to do with radiography within that chapter. So that's going to be fun. Okay, I'm seeing some radiography questions, so that's a good start. Okay, here we go. So, question 1. A patient attends for the first stage of endodontic treatment on the upper left central incisor. Which one of the following radiographs is most appropriate at this stage? So the multiple choice answers are A, bite wing, B, cephalogram, C, dental pantomograph, D, lateral skull, E, periapical. Let's just break that question down really quickly. So basically what it's asking is somebody has attended for the first stage of endodontic treatment on the upper left central incisor, so that's the upper left one. Which one of the following radiographs is most appropriate at this stage? So let's try and eliminate some of these answers. So it's not going to be a bite wing because bite wings are at the back of your mouth and this treatment is at the front of your mouth. B, don't know what this word means, so I'm going to rule that one out as well. Dental pantomograph, I'm going to say no because I think that's the big one that goes around your head, which I know is an OPG. D, which is lateral skull, don't think you're going to need the skull in it either, so that leaves E, periapical, and that's the answer I would have said anyway. So I'm going to go for answer E, periapical. Correct answer E. So I got that one right. The dentist will require a full-length radiographic view of the tooth in order to determine the presence of any root curvature. So basically what it's saying is that the reason it needs a periapical x-ray, or a PA if that's how you know it, is because they need to be able to see the full root in order to know how difficult the treatment's going to be and to see if there's going to be any curvature on the root. So I'm just going to put that down as yes, I got that one right. Okay, now we need the same category. A mother has brought her 13-year-old daughter to the surgery expressing concern that the teenager's upper canine teeth have not yet erupted. Which one of the following types of radiograph is most likely to be used in order to locate these teeth? The answers are A, bite wing, B, dental pantomograph, C, lateral skull, D, occlusal, E, periapical. I'm going to say it's B, dental pantomograph, or an OPG if that's how you know it, mainly because that would show everything, and that's particularly useful if you want to know if somebody's got wisdom teeth coming through because it will show everything. Now it could be an occlusal. I'm not entirely sure what this radiograph is. Can you guys see now why I'm rubbish at radiography because I don't know what half of the x-rays actually are? It could be a PA. Do you know what? I'm actually going to change my answer. I'm going to go for D, occlusal. Obviously that means occlusion, and Let's just go for D, occlusal. It's going to be wrong probably, but okay. Correct answer, D. Oh, I'm glad I changed my answer now. So, as both canine teeth are absent after their normal eruption range of 10 to 12 years, so basically what that means is that the canines come through when you're about 10 or 12 years old, an upper occlusal radiograph will show the presence or absence of one or both teeth after a single exposure. Basically what this is telling you to do is limit the patient's radiograph exposure by doing the occlusal x-ray. That was kind of guesswork. It was complete guesswork, I'm not gonna lie to you. So let's put another yes down for that. And let's move on to question 3. A 30-year-old patient attends a surgery for a routine dental examination and bite wing radiographs have been taken. The surgery has a manual processing system. Which one of the following sequences ensures that the radiographs are processed correctly? So the multiple choice answers are A, developer, fixer, wash. B, developer, wash, fixer. C, developer, wash, fixer, wash. D, wash, developer, fixer. E, wash, developer, fixer, wash. So I have not done this since I was in college. Now I'm going to have to try and remember, which I can't, the thing that I came up with to help me remember this. I personally don't know of any dental practice which still uses manual x-ray processing. There might be some out there, and if you know of some, great. For me to try and guess this, literally going to be a case of remembering what I learned 5 years ago. I know that I had what were they called? Where you remember the beginning letter of each word, and I know that I remembered it as DW from the kids program Arthur, if anybody watches that. So I remembered it as DW, and then I can't remember the rest. So that means it's got to start developer wash. There's only 2 options which start with developer wash in these answers. I'm sure that there was 4 stages. So my answers with developer wash first are either developer wash fixer or developer wash fixer wash. And because I remember it starting developer wash and there being 4, I'm going to say the answer for that is answer C, developer wash fixer wash. Okay, correct answer C. Oh, I did get that one right. I'm very proud of myself for that. That was purely because I remembered Arthur, the kids program, DW. But if I didn't remember that, I would have had absolutely no clue. Just going to put that out there. And I'm not going to be able to remember all of these questions either. Basically what I'm getting for that is that any solution you put it in, it will then need to be washed off. So I guess that could be a way to remember it, is that you put it in a solution, then a wash, solution, then a wash. So anything that goes on it will need to be washed off. So that could be a way you remember it. I'm proud of myself for that. Let's write another yes on that tally. Okay, 3 more questions to go now. So let's go back to that. The dentist has taken a periapical radiograph of the patient's upper left canine tooth after completing root canal therapy on it. After processing, the radiograph appears very pale and the image of the tooth is too faint to be seen adequately. Which one of the following processing faults is most likely to have occurred? So the multiple choice answers are A, developer solution too cold. B, developing time too long. C, fixer solution too concentrated. D, fixing time too long. E, not washed thoroughly. Genuinely cannot remember whatsoever. I remember doing something to do with processing faults, so I definitely remember learning this kind of stuff in college, but what I actually learned, I can't remember at all. So this is gonna have to be some guesswork. What would make the image too pale? Now, if we were just developing a normal picture, I would say that you've probably left it in water too long, so you've left it in the wash too long. But there isn't an option for that. This is turning into an absolutely complete guess now. I'm gonna go answer C, fix the solution too concentrated. Correct answer A. So that was definitely wrong. The developer solution must be at the correct temperature and concentration to develop the radiographic image effectively. Okay, so this one was to do with temperature. So basically the developing solution was too cold, and to process the image correctly, it would need to be at the correct temperature. Actually, this could be a little tip for you. If you know somewhere that does manual processing and you know that you've got manual processing questions coming up, maybe contact that practice and ask to go and watch them, because if you see it, it will probably click a little bit more. Got 3 right, I'm happy with myself so far. If I can get another 2 right, That's brilliant. Okay, here's another one which I'm probably definitely not going to know. During your training course, you've had the opportunity to dismantle an intraoral x-ray film packet to view its contents. Within the packet is a piece of lead foil. Which one of the following correctly states the reason for this foil to be present in the packet? Now the multiple choice answers are A. Absorbs scatter, B. Allows the packet to be bent easily, C. Reflects x-rays onto the film, D. Intensifies the image, E. Focuses x-rays into the beam. Not a clue. It literally says in the question that in your training course you had the opportunity to do something. Do I remember it? Do I heck? So again, this is a massive piece of guesswork. I'm just going to say A. Absorb scatter. Honestly, I have no idea. It's just a complete guess. Correct answer A. Ooh! When an X-ray beam is fired at the body's tissues, those rays that pass through the tissues are either absorbed or scattered. Okay, not going to take any credit for that. I got it right, but it was an absolute complete guess. And if that was in a real dental nurse exam, I would have just clicked A and hoped for the best. And now on to the very last question. A patient attends to surgery following a blow to the face, which has resulted in the fracture of both upper left incisor teeth. The dentist has taken a periapical radiograph of the teeth, and after processing the film, the images of the teeth appear to be squashed and stunted with little diagnostic value. Which one of the following exposure faults is most likely to have caused this effect? So the multiple choice answers are A. Coning, B. Elongation, C. Film movement, D. Foreshortening, E. Underexposure. So I need to break that question down a little bit. Somebody's got a blow to the face and they fractured both upper left incisor teeth. So upper left 1 and upper left 2. So what will cause an X-ray to be squashed and stunted? I don't even know what foreshortening is. My best guess is going to be film movement. I'm going to say that the film has moved inside the mouth and it's just caused it to be not a very good picture. I'm going to say the answer is C, film movement. Correct answer D. Oh, which was foreshortening, which I didn't know what that meant. So let me tell you what foreshortening is. Without the use of a film holder, the X-ray tube head and the film will require positioning so that a bisecting angle technique can be used. The image of the teeth will appear squashed up and much shorter than they actually are. This is called foreshortening. Oh well. Okay, so in total, I didn't do too bad. I got 4 out of 6 correct. I don't know what percent that is. If you want to work it out, great. I don't know. I'm not going to do maths right now. I can't. My brain can't focus on maths right now. No. But I didn't do horrifically, and I did get some right. So I'm quite pleased with myself for that. Were they complete flukes? Yeah. Do I know anything about radiography? No. Has this video helped you at all? Probably not. That's as best as I can do for radiography, but I tried. It was so long ago that I did college. I can't remember college at all. Maybe I shouldn't even be doing a dental nursing channel because clearly I can't answer half the questions that are given to me. Anyway, that is pretty much it for this video today, guys. I hope you enjoyed it. You probably didn't because it was actually really crap and I'm very sorry about that. But if you did, then please give it a thumbs up. Click that subscribe button down below and then click the little bell next to it so you get notified when I next upload. And I'm also on TikTok now. For those of you that are still watching and you want to follow me on TikTok, then my name is just @Charlyfroud on TikTok. So go follow me on there and I hope to see you there. If I don't, then I will just see you in my next video. Bye!